Today's topic is going to be dealing with weight loss drugs. And neither Nora or I have an MD behind our name.
We're not doctors. We're not pharmacologists. We're none of those things.
We're not.
We're just trying to give you some information that was useful to you as a trainer because we know people are going to be asking you questions.
Exactly.
That's really the whole point of this. We want to be really clear at the beginning.
Yeah, so we are not giving you medical advice. We are just stating what's out there. Here's information. And when in doubt, please talk to your own doctor or have your clients talk to their doctor. Okay, this is not medical advice today. So enjoy the show. Welcome to Moving Conversations, a podcast for movement professionals by movement professionals. If you coach, train, or teach movement, Pilates, or fitness, then this podcast is for you. With more than 60 years of experience in fitness and Pilates, your hosts, Brian Ritchie and Nora St. John, explore the science of human movement, diving deep into the facts, myths, and common misconceptions, hoping to spark thought and conversation about how we view fitness and movement. Now, let's jump into Moving Conversations. And welcome back to Moving Conversations. I'm Brian Ritchie. Joining me as always is Nora St. John. Good morning, Nora. How is it on the West Coast this morning?
It's a little gray and overcast, but it's not bad. It's California. It'll be 40 degrees today.
40's not bad. 40's pretty good. We're going to be around the same, but we're expecting another storm coming through. In fact, they're talking about a couple of storms in the next week. So, we never know what we're going to get. Washington, D.C. is in this little weird bubble. We never know if we're going to get rain or snow. So it's always, what are we getting today? So we'll figure that out. I'm very excited about our topic today. It's something that's been in the news a ton over the last 6 months. I can't tell you how many different podcasts from so many different public health sites that I've listened to. And it's gotten all the way into more mainstream media that we're seeing it on, just regular news. And that's weight loss drugs, primarily Ozempic, which is the hot topic one.
Right. And I think, we thought this is a first of the year situation.
Yep.
Many people at the first of the year decide this is the year I'm going to lose whatever I want to lose.
Yep.
And this is kind of new. I mean, I really hadn't heard about this much till this last year.
Mm-hmm.
And I thought, our clients are going to be on this. They're going to be asking us questions about it. And I thought we should just help give you guys, whether you're a client or an instructor, some information that might help you in making decisions about this or just understanding a little bit better.
Yeah. Yeah. The last time we had anything like this, I don't know if you remember, but this was back in, I want to say, the late 90s was Fen-Phen.
Yeah. That's what I was thinking.
That was the last time we really had something like this happen. And that was pulled off the market in 2004 because it was shown that it could cause potential pulmonary hypertension in patients. And that's huge. When something causes death, maybe the FDA should do a little bit of, let's step in and stop this just a little bit. So
yeah, that would be the good job.
That would be a good job. So, and they did that. And there's also another one that they pulled off recently that we'll talk about a little bit later. We're going to go over all the different, most common weight loss drugs. And a lot of times people wonder why we should know about this, but our clients are going to come to us and first of all, ask our opinion on things. So we should have an understanding of what these things do in a general sense. And secondly, we need to know when our clients are on them because it can definitely affect, especially Ozempic can definitely affect what we're going to see in our clients in front of us, not only in weight loss, but also with the side effects.
Right. I think these are things that just, again, it's good to know this is a very key part of what we do. Many people come to personal trainers or Pilates clients to lose weight.
Yep.
And I know that this conversation will come up. So we just wanted to give you guys some good background on it.
Exactly. And I'll give everybody a little bit of my background. I've suffered from weight issues my entire life. So for me, I've done a lot of research into every aspect of weight loss drugs. At one point, I was over 420 pounds. I'm down to 190 at the moment. And, I've had to have medical intervention in the past. And it's important to figure out what's going to work for the person in front of you. And that, I hate to say this about personal trainers, by the way, this is a part one of two-part when it comes to weight loss, because next week we're going to talk about working with clients who may be obese and overweight and what we really need to focus on. But we thought we'd start with this one this week first because it is the hot topic. But there's always a stigma involved in weight loss. And a lot of times personal trainers have always had that perfect body. They've never suffered or, had to deal with a weight issue. So a lot of people think, well, just eat less, exercise more. And that generality may work for 70% of the people, but we all know when it comes to hormones, when it comes to menopause, when it comes to a lot of different things and blood sugar, etc., those issues could be way different depending on the client in front of you. So whatever, for us, it's whatever works for that client is what you really need to focus on. And so I want to sort of take the stigma out of these drugs, because I don't know if you've seen this, but when Oprah came out recently and said, hey, I've been doing this, and yes, I've been on, because people immediately said, oh, it's just the drugs. It's just the drugs. And I said, that's okay. It's a tool. It's nothing different than the treadmill. It's nothing different than the weights that are in front of you or the reformer or any other tool you use to accomplish your goal, whether it be to get stronger, to get leaner, whatever it is. It's a tool. And she still had to watch what she ate. She still had to exercise. She still had to take care of herself. It wasn't as though she was just, oh, I'm going to take this magic pill, which everybody wanted, the magic bullet, the magic pill. Look, this helps, but it doesn't solve all of the problems. And I think that's a huge thing for us to realize, is that it is a tool. There shouldn't be any stigma with it. And if it's helping your client, why not? Why not? Let it help them, and they'll see their results faster. I got to tell you, if I went to a personal trainer and I was seeing results really quickly, I would want to probably stick with that trainer, even if I was getting help from that medication or whatever, because there's a lot of different medications for diabetes that sometimes promote weight loss, like metformin, that can help. So if I go to a personal trainer and I'm seeing results even faster, chances are I'm going to want to work with that trainer even more, because I'm going to associate my rapid results with that, even though the weight loss drug may be helping. So why don't we jump into Ozempic and discuss what it does, what it is, and, try and, destigmatize it a little bit, and also help people to realize that there are different choices out there. So let's jump on in.
All righty. The first thing I want to say is, again, in doing the research for this, Ozempic is one drug. There's 3 different brand names for the same chemicals, basically. This is all semaglutide or whatever.
Yep, semaglutide.
So Wegovy, Ozempic, and Rybelsus are all the same drug, just different names. And this is one of those things that's always really confusing whenever you get into situations like this. It's like, is that the same thing? Is that the same thing? Why is it different?
Yep.
So I just wanted to bring that up. And how does this drug work, Brian?
Well, it's a GLP-1 agonist. And what that means is GLP-1 is a glucagon-like peptide receptor. And honestly, for weight loss, they're not 100% sure why it produces such great weight loss. There's a lot of theories out there, but there's been no true cause and effect that's been proven. One thing is it works in your gut. It works as a gut peptide that actually works in your gut that helps stimulate fullness. So your brain gets the signal that it's full. And I experienced this. I've got a number of clients on it. And one of them said this was the first Thanksgiving that I ate everything I wanted, but I just had a little bit because I was so full so quickly. And there's a couple of things with that. Couple of different side effects. The feeling full does go back to the brain. That's part of it. When you look at the stomach, the uppermost portion, when you look at it and it sort of looks like a sausage that sort of goes up at one end where the esophagus is. Well, the esophagus isn't the highest portion of the stomach. There's a portion above that. And from what I understand, that's the portion where we actually get sort of that fullness. So when you eat and your stomach is actually full, when that sort of gets a signal in that region, it's sort of like, oh, okay, I'm full. And it signals that satiety. This supposedly works with your gut peptides and allows you to be fuller quicker. So you get that sense.
And my understanding is it slows down food leaving the stomach and then going through the intestine. So it does it through slowing down that, which means that the signal is in that area longer, presumably.
Yep. And that's actually going to come under side effects because gastric emptying is a huge thing. What they're finding is that in surgery, when anybody needs to get an endoscopy, usually you stop eating, the day before, don't eat dinner, stop the day before. Well, they're finding that they are having to have the people stop the Ozempic, the week before because there's still food in the stomach. They're going down there and they're still seeing food in the stomach, even though the person hasn't eaten dinner the night before or even lunch the day before. They're still finding that food is still there being processed. So that's why it's now becoming more about among gastroenterologists who are doing endoscopies that they're telling their people, please get off the Ozempic for 1 week before and don't eat anything for at least 24 hours before the surgery. This is becoming more common a practice. And it's something that people are actually asking their patients, are you on this? Because it can affect what we see. And no one wants to have to go back in again, and go under anesthesia and everything. But that's definitely a side effect. Now, so those are two things that does occur with the GLP-1 agonist. Now, the difference between the different types, okay, Ozempic was the first one that came out, and that actually helps regulate blood sugar as well. It helps to lower blood sugar.
These are originally diabetes drugs.
Yes.
These are originally diabetes drugs, and they increased insulin. Ones. So just know where they started. Like, this is where they started.
Exactly, which is also a reason why one of the side effects for some people has been pancreatitis, where you get an inflammation because your pancreas is now producing too much insulin. So they were seeing an inflammation. Latest research isn't seeing as much as the original, but it's still something just to be aware of that can happen. But with the Ozempic, it was a weekly shot, a weekly injection. You give yourself subcutaneously, easy injection, and they ramp you up. They start you at a non-therapeutic dose and ramp you up till you're on a therapeutic dose. Now, the difference between that and Wegovy is a higher dose.
Yeah.
So that's the main difference between those two. So you are taking more of the medication with the Wegovy. Okay? And I can tell you that the side effects oftentimes are ramped up with the larger dose. What are the side effects, Brian? There's a lot of them, primarily GI. We see nausea in around 50 to 60% of the people that take it. There's significant nausea. Also comes down to diarrhea, constipation, loose stools. There's a lot of that's happening.
Yeah.
So that's something to be aware of because there's a number of people who try it and they can't put up with the nausea.
Yeah.
And because it's a weekly injection, what they're also finding is that they're getting the injection and it's terrible for the first 3 days, the nausea. But as the week goes on, it becomes less and less and less. Now, this is anecdotal, but I've had a number of clients tell me that they've had that experience. Now, again, it's only in 50%. I've had a couple other clients who are taking it that said, I have no side effects whatsoever, and it is a miracle. And almost all of them to a person say, I am no longer hungry. I can walk past, you can have pizza, and it's like, it doesn't even sound good. And that's huge for a lot of people because it really takes away those cravings. And that's actually what some research is coming out about right now is that they're looking at it for other reasons besides weight loss and diabetes is they're thinking, can it be used for addiction studies? So that's a side effect that they're thinking, that may have a positive effect down the road. Now, hypoglycemia is also something that we're seeing. Now, this is something that you need to be aware of if you're training anybody with this, because hypoglycemia is a rapid drop in blood sugar. Exercise causes a lowering of blood sugar. I've got a friend who's a diabetic. He needs insulin. When he has a hard time getting his blood sugar down, he goes for a jog, and he says nothing works better. It comes back down, and he's fine. So exercise does lower that. So on this, if it's already lower, you may experience even a lowering of the blood sugar. Now, and I can tell you from experience, I have reactive hypoglycemia myself. And for me, I average between anything lower than 70 is considered sort of danger level. Okay, that's when people start feeling a little faint. They get a little headachy and not, maybe a little like, oh, I don't feel quite right. Mine averages 70 to 75. And after I eat, it goes up and then it rapidly plunges. And I can get as low as in the low 50s, and I've passed out a couple of times because of it. And so I just have to monitor mine. While I have a number of clients that we have to monitor them during their session. And I actually keep lifesavers around. And the candy, I tell them when they walk in, they come into my office, they grab a couple. And for that, they need it because during intense exercise, there's like, oh, yep, I can start feeling it. They have the lifesaver, they suck on it, they feel better. It usually takes about 15 minutes for it to come back up, but you can see that they already are recognizing that blood sugar is dropping. And because of it, they're like, okay, I feel this, I'm going to take that. And then they feel better. If they don't, when I'm remembering one client specifically, when she went on Ozempic and she wasn't even on the therapeutic dose, a lot of side effects with nausea, but she came in for her first session after being on it. And she said, I just don't feel good. She said, I'm dizzy. I got to sit down. And we only went about halfway through the session. And we were finally ramping up her exercises. And we did the shuttle leg press. And we weren't even going that. And she goes, I really feel bad. She said, I think I said, do you need candy? She said, yes. Yes, I think that's what it is. She took it. We had her lay down. And it took a while for her to recover. And she felt horrible. And she had to talk to her doctor. And the doctor told her this can happen, especially with exercise. So if you have clients who have, this as a tendency, and you can ask them, keeping something on you like a lifesaver or something simple, or making sure they've eaten before they work out. What we discovered with her is if she has a banana for breakfast before she comes in, she actually can work out. And it's like, oh, I don't feel like I'm dropping that much, because she's sort of preloading those carbs before she comes in. So it's like, oh, I'm doing okay. I'm feeling all right. So that's just something for you to think about, especially your clients who come in after all I've had to, eat this morning is a cup of coffee, that they may have this as an issue. So that side effect is something to be, conscious of as well, that it does sort of happen. But again, the benefits far outweigh the risks of this, because lowering the blood sugar, it's helping you create more insulin. So those people who are insulin sensitive or glucose sensitive that aren't producing enough and have high blood sugar all the time, it's really allowing them to lower it on a regular basis. So it's great. They're seeing such great results from that. And again, the weight loss is a side effect, a benefit.
One of the things that I think is important to point out here is these are generally approved for people with a BMI of 30 or higher.
Clinically obese.
Or for somebody with 27 and higher who has a comorbidity,
Yep.
who has high cholesterol or heart disease or something else going on.
Yep.
So this is something where, I just think about a lot of my clients. And I think, oh, great, I need to lose 5 pounds for a wedding. I'll start taking Ozempic.
Yeah, no.
That's not really what this is designed for. It's really not designed to do, spot reduction.
Yep.
And I just wanted to bring that up because it certainly sounds like, oh, I'll just take this and I'll lose my 10 pounds for my wedding and it'll be great.
Yep.
That's definitely not what it's designed for.
No.
The other thing too is when you read all the literature about it, this is something where if you commit to this, if you have had a situation where you cannot control your weight due to all the many factors that can come into that, and you start taking this and it really does get you to the place where you want to be, you may be on this forever.
Forever.
Because once you stop, like with almost any other weight loss situation, you typically gain back some percentage of whatever weight you lost.
Yep.
And, so this is one of those things where, yeah, it's kind of a magic pill, but it's not a forever magic pill. And so if you can tolerate the side effects and stay on it for as long as you need to, that's great. But do know that when you come off of it, there may be issues. You've got to make sure that you have really changed your habits, changed everything else, if those are going to be effective for you.
And
I don't even know if they are.
I'll be honest though, getting off of it, because it's actually changing your hormones, those gut peptides, because they are no longer there, It's not just healthy habits. It's literally going back to the way you were before. So you're going to be much more prone to regaining it just on a chemical basis and a physiologic basis, not just on the, oh, you don't have willpower. Again, goes into that stigma. I have one client who can't get it. Every pharmacy in Washington, D.C. is completely sold out. So he physically can't get it. He has it. He has the prescription. He needs it, but he can't. He was on it for 3 or 4 months and lost quite a bit of weight, and his blood sugars were doing great. But then all of a sudden he can't find it and can't get it. And he's started to go back and he says, oh man, my appetite is back. He said, there's a big difference between being on and off of this. And he realizes.
You feel the bounce, like you really like bounce right back to where you were.
Exactly.
It doesn't change behavior. It doesn't change your brain. It just has a temporary change out while you're on it.
Right. And they say it actually causes similar effects, mimics some of the effects of bypass surgery and sleeve surgery, bariatric surgeries that we see, because it does. These are things that physically change when you've had those surgeries, but those are more on a permanent basis, but they're altering you physically. So they're literally, it's going to be a physical alteration that occurs forever, like a knee replacement. This is just what you've got to live with, and there are side effects. There's positives and negatives to that. And, you know, we can talk about that at a later date, but that's a permanent basis. This is very temporary because it is a drug. And it can be, like I say, as soon as you stop, boom, there it goes. It's back up. And something that people don't think about is the cost consideration.
Yeah, when I was looking at these, I mean, you look up, I mean, it's very, very hard to find the cost of drugs because every drug site wants to say, oh, just, you know, talk to your insurance company, maybe something. And
maybe we'll give you a coupon.
But basically, it's right. Yeah, exactly. It's like $1,600 to $1,500 a month is the cost. Now, your insurance may cover it. A lot of insurances don't. There's a lot of that's a real gray area at the moment. But that's significant. I mean, that's a major investment. You know, that's a house payment
and
for some people. It's certainly multiple car payments. That's per month, exactly.
Exactly. I don't think I mentioned this. I consult with and was working for a while with the National Center for Weight and Wellness here in Washington, D.C. And a lot of the clients we were working with were on various drugs, which is why I happen to know a lot about all the other types of drugs, which we're going to talk about in a little bit. But I was working with a physician, Dr. Scott Kahan, and we were discussing my situation because I couldn't. I ate perfectly. I was exercising 6 days a week for 2 hours at a clip. I was eating less than 1,200 calories a day and still gaining weight. And I mean, the doctors at first don't believe me until they realize when they see what I do and they say, wow, that's really strange. And we were able to finally figure things out and whatnot. But when we were talking about it, he actually mentioned this way back when. Before these drugs came out, there was an original GLP-1 agonist. And he said, look, this is only for diabetes. You don't quite qualify, he said, and not a single insurance is going to cover it, and it's $1,500 a month. He said, I do not recommend doing it. He said, it does help. He said, it helps a lot. But he said, this is a very expensive drug. Now, here in Washington, D.C., we have a lot of wealthy people, and there are people who are willing to pay that and have no problem with it. The cheapest I've seen it is $859. That's the cheapest I've seen for a month. Most I've seen is about $1,600, $1,590, I think is what I saw. The prices are going to fluctuate. People are going to Canada to get it because it's about a third to half in Canada. I think the Netherlands are paying even less than that. So you're going to see a lot of these drugs sort of come across the border. But like any other drug that comes across the border, you have to be wary about where you're getting it from because we're seeing imitations pop up left and right now.
One of the things I did just in preparation for this was I looked on Wegovy's website and I looked on, just to look it up. And on the very front page of their website, it's like, be aware of counterfeit drugs.
Yep.
Like that, I love what, and for a drug manufacturer to have that as like first page on their website says this is a serious problem.
Yeah.
And, counterfeit drugs, they may have the same stuff in them as the real drug. They're often just like every other, counterfeit drug out there. They're designed to look like the real thing, packaging and everything else typically. But it may not have the same amount of primary active ingredient. It may be mixed with other things. You don't know. So this is another thing where you want to make sure you have definitely do it by prescription And don't just buy random stuff on the internet, just as that's a general rule of anything
Yes.
pharmacological, but I really want to emphasize it here.
Yes. Something to think
Yeah,
about
so
with
just
this.
things to be aware of.
We Any client that can afford us often can afford to go to a place like Canyon Ranch or one of these, you know, Club Med-ish places, but they're there to lose weight. Okay.
Right.
They're all over the United States. Well, a lot of these are now doing what they call compounded pharmacies. So they're making their own drugs there. So they're
Oh,
combining drugs, they're creating their own version of Ozempic, and they're just be aware that your client may come back from one of these places and say, "Oh yeah, they put me on Wegovy. They put me on Ozempic, or I'm taking this pill." Now, the difference between Rybelsus and the other two is it's an oral tablet, and it's not as effective, but it still works. I've got a couple clients on it. It still does work. It's just a little less effective. So just be aware that these compounded pharmacies and compounded, prescriptions can be a dangerous area. They can be a very dangerous area, especially when they start to mix and match.
yeah, because this stuff is. I mean, we're looking at the research on this. There's a lot of research done on how effective it is,
Mm-hmm.
and the research is really compelling. Like there is, lose 15% of the body weight,
Yep.
5% of the body weight, even up to 20% of the body weight.
Yep.
So there's a lot of, and again, a lot of that is dose dependent.
Yep.
The other thing about losing a lot of weight is there's also just that other issue of, your clothes are changing, your muscles tones are changing, and what kind of weight are you losing? Are you losing fat or are you losing muscle?
Mm-hmm.
And so I think the other thing too for us to just know is that maintaining your workout regimen, maintaining the stimulation to your muscle tone during this is really important to make sure you don't lose as much muscle as you lose fat, because they
Yep.
can both go when you lose weight. And especially if you're an older person who's prone to, muscle loss anyway, you
Yes.
really want to make sure that you're not just losing, muscle mass, but you're focusing more on the fat and maintaining the muscle as best you can.
Yeah, absolutely. Absolutely. Now let's talk about some of the positive side effects of the GLP-1 agonists. We're seeing a reduction in fatty liver enzymes. So people who have liver disease, they're seeing that may be reversible. It's one of those big question marks. Now keep something in mind about all of these that I think is really important for us to think about. These drugs have really, especially the semaglutides, are only been around for about 5 years. So the longest, there's a study that's about to be published, and it's one of the longest ones that it's out there is 5 years. So we really don't know the long-term side effects of these
No.
yet. We really don't. However, another one that just came out within the last 6 months study shows that cardiac events are reduced by 20%. Now we're talking stroke, we're talking heart attacks, we're talking heart episodes. 20% in people that were not diabetic that are taking Ozempic. That's huge. You got to admit that's really big. And again, we don't know a cause and effect. We don't know if they lost 15% of their body weight. They were 200 pounds. Now they're down to 170. They're not carrying as much weight. There's not as much, fatty liver issues. There's not as much of that obesity around the belly. So the heart disease risk goes down. We don't know if that's the reason or if it's truly because of the drugs. They don't know that yet.
Yeah, to be determined.
Yeah.
But that is, I think that is one of the things for me is just looking at there's not the long-term stuff. Again, the little long-term stuff they have suggests it decreases your risk factor for the things that come with diabetes and heart disease, because it decreases all those markers, right? So it does that's the beneficial side. What else it does will to be determined.
Absolutely. And my mind goes to the communities who may have issues with premature death. We think that a lot in African American communities where, there's a lot of, heart issues and health issues.
Yeah.
And I'm thinking, oh my gosh, this could really be a huge benefit, because you hear, I've worked with a lot of African American clients who talk about their sugars, and they're talking about diabetes, and their blood sugar is really hard for them to control. Well, this could be a game changer for them, a true game changer, not only for losing weight, but also for controlling that and not being at such a high risk for heart disease, for stroke, for loss of limb, because I've had some have to, they lose their limbs because of diabetes. So, I mean, this could be a huge game changer.
Absolutely. Absolutely. For, with recalcitrant weight loss or recalcitrant overweight, it's like it's critical because that is not always controllable by just modifying behavior and diet.
Yeah,
It
absolutely.
doesn't work for everybody at all.
One of the
Cool. So
drugs, oh, go ahead.
yeah. There's a few other
Yeah.
drugs. I know a new one, Mounjaro, also called Zepbound,
Yep.
which has
Tirzepatide.
two. Yeah, exactly. Has both the GLP-1 and a GIP agonist.
Yep.
And so it's two things working in the same direction. And supposedly it's even like faster weight loss because there's two insulin increasing compounds within it.
Yeah. Think of the second one. The second one's a glucose-dependent insulin-tropic polypeptide. The way I've described it before, it turbocharges it.
Right. That's what it sounds like. Yeah.
It really does. It hasn't been published yet. It's a pre-published paper. I read it over this past week that hasn't been peer-reviewed, hasn't been published, but it's on the way to that. But it's sort of gotten out in the community. And it is showing that this drug, the Mounjaro, the Zepbound, is by far and away seeing better results. A higher percentage of people, as well as a higher percentage of people are losing weight versus the Ozempic. So there's a good possibility. And it was just, you and I, before we started recording, I looked it up because I saw that the FDA had approved the Zepbound version, which is their version of Wegovy, so that can be used for weight loss, has been approved by the FDA. So this is going to, I guarantee within the next year, you're going to hear a lot more about Mounjaro and Zepbound because, again, if it's turbocharging it and you can get it. Like I said, Wegovy sold out. Ozempic sold out. Whereas this one, not sold out yet. So people can actually still get these drugs. So that's something just to think about.
So, Brian, I feel like this radically changes the environment in which we work.
Yeah.
Right? I mean, it's like you think about how many customers come to you as a personal trainer or me as a Pilates teacher specifically for weight loss. Like, I think personal training is a little more, but Pilates too.
Sure.
It's like, I want to exercise, I want to lose weight. And certainly many people in our profession have taken on, for better and for worse, nutritional advice, other kinds of things.
Yep.
And there's a lot of opportunity to do that. But this really completely changes the situation because there's never been anything like this that's worked this well.
It's a game changer. It is a true game changer. And let's go over some of the other drugs, and I want sort of a compare and contrast. And the reason I'm doing this is because Wegovy Ozempic shows about a 15% on average body weight loss. So again, if you're talking about someone who is significantly overweight, we're going to say 300 pounds. That's 45 pounds. That's a significant amount of weight loss in a year, just in a year. Now that can continue to go as they continue to take the drug. Whereas Mounjaro has been showing 20+%. So that's a huge game changer. Okay, so keep those numbers in mind. Okay, we're talking about 15 to 20%, even up to 25% of body weight within the first year, which is gigantic. We would consider in obesity medicine 10% to be huge. With any of the drugs that were out there, they said if you lose 10% of your body weight a year, which in a lot of people's minds, they're like 10%, that's hardly anything. But they considered that significant weight loss was 10%. So the old school drugs that are still out there, the one that's been around forever that, goes way back in time is phetamine. It's most widely used weight loss drug. I was on it. I was on a pretty massive dose. I mean, I was on the highest dose. Most people, and think of it like speed. It basically speeds you up. The side effects are headache, overstimulation, high blood pressure, insomnia. I was told, doctor actually said, okay, we're going to try this, but understand you're probably not going to sleep. You're probably not going to sleep because it can really stimulate. And he said, we're going to put you on a big dose. So I had no effect. Literally, I had zero side effects and I had zero effect. So a lot of these other drugs, they say you take for a 6 or 8 week period, and if you don't see any weight loss, come off it because it's not working. Why have it in your system? But patients were usually seeing about 5% body weight loss in a year, 5%. And they considered that great. From a medical standpoint, 5% was great.
And the side effects were enough to have it
Serious.
pulled. And yeah, that was just in terms of mostly blood pressure, cardiac incidents. It was just not considered a good thing to be on long term for
Nope.
those reasons.
But it's something that a lot of people are still on to this day. A lot of people, that was sort of the first step. Now, there's a new one out. I say new, probably 10 years old by now, called Casemia. And that mixed phetamine with topiramate. And topiramate was originally around, it's to help cravings. 2 drugs were combined, and it worked really, really well. The problem is the topiramate, you could have some serious side effects, mental side effects with this. Yeah, and that was an issue. That was an issue that when I was looking it up, because I was put on this as well, and I was looking it up, and there were a lot of people saying they were having suicidal thoughts and all this kind of stuff. So it was a scary one to think about. And I had no side effects, but I also had no effect. It didn't do anything for me.
And it's originally an anticonvulsant, so
Yeah.
which is directly having neurological impacts.
Exactly. But what they found was they took the doses of both the phetamine and the topiramate and lessened them to we're talking microdosing practically. But it helped with cravings as well. So it sped you up and it helped with cravings, supposedly. So it decreased the appetite. And it worked. Again, people saw a maximum of about 10%, 5 to 10%. And if not more than 5% was seen in the first 12 weeks, they pulled you off of it because the side effects were abnormal sensations, dizziness, altered taste, insomnia, constipation, dry mouth. And believe me, when you're on these things, you'll know the side effects can be incredibly irritating, incredibly irritating. And the reason I say that is at one point I went on with I was put on 2 different drugs. Again, we were trying to jumpstart my metabolism. And my physician, who's a great physician, said, we're going to try this. We're going to try it. I don't know if it's going to work. And when I went on it, it was thyroid medication as well as a diabetic medication, because at the time my numbers were getting a little high. And it was metformin. And I had such incredible GI problems. And I put up with it for about 3 weeks. And it was horrific. And I called up I became friends with him, and I just called him up and I said, look, I'm having these issues. And he said, oh my gosh, stop now. He said, you should never have to go through anything like that. Ever. So be aware that if your client starts complaining about anything that seems distressful, like I can't make it to the restroom. I had one client go on medication that on his way walking over from his home, he had a major accident, GI accident, just walking to the gym in the morning. And it was like, okay, we got to clean this guy up and get him home because the medications had such a drastic effect. So just be aware that can happen. There's a potential, very slight amount of people have that, but those side effects do exist, and just be aware. Another one was very popular, and in fact, there was a trainer that I used to see every year at one of our events who would come and take my classes. Got to know her a little bit. One year she came, and oh my gosh, she looked amazing. And she was closer to my age than, a lot of the people in the class, which were closer in their 30s. She was in her, early 50s, late 40s. And she looked amazing. I started talking to her, and it's a drug called Contrave. And it's an opioid receptor antagonist and an antidepressant. So it's Wellbutrin combined with an opioid receptor antagonist. And originally this was put out there for smoking cessation. And they said, but people are losing weight because it was getting rid of those cravings. And she said she went off of it for a little while. She said, my cravings came right back. I started gaining weight. I went right back on it. Boom, no problem. Like a lot of these drugs, though, it only works on about 60% of the people who take them. Didn't work on me. It was another one. I went right to the doctor. I said, what do you think about this? He's like, hey, let's give it a shot. Didn't work. And I mean, we knew within weeks. He said, any difference? I said, not at all. So again, mine we found was a metabolic issue, and we had to do some pretty extensive things to cure my issue, which we can talk about at a later time. But these drugs didn't have that same effect on my body as they did on other people. And my physician just said, he said, hey, it works about 60% of the people. And that's about it.
And I think that's true for, for any of these things. So any of you who are thinking about this or have clients on this or, whatever, like, first of all, make sure that they're under the care of a doctor, because some of these do require regular testing of things like, liver enzymes and kidney function and different kinds of things, just to make sure nothing's going funky. There do seem to be, at least in rats and only in rats, some issues with some thyroid cancers and thyroid tumors.
Medullary thyroid issue.
Which don't seem to show up in humans. Yeah, but just to be, be aware of that. Make sure you're under the care of a doctor. Again, this is not medical advice that we're giving you, just to be really clear on that.
Absolutely.
We should have, done that at the beginning. This is really just things that we want you to know, because you will be working with clients who are using these things, and we just want you to know something about what's happening. Because if you just read the newspapers, you're not going to get a very full view.
No.
You're not necessarily going to be able to give your clients, the best advice that you can give them, knowing that your first advice is don't talk to your doctor about this. Make sure it's appropriate for you.
100%. How many of us, I consider myself a secondary, sort of a secondary medical, practitioner, in that they see me a lot more than they see their doctor. But I am not a doctor. So they come to me asking me for medical advice. And my first thing is always talk to your doctor. What's your doctor say? I said, I'm not a physician. I can't give you advice like that. However, I can tell you, eat better. Let's do some cardio. I can affect a change physically on you. I can help you with cardiovascular issues. We can help with a lot of issues. Exercise and movement can do so much, but I'm not a physician. And the same thing here. Just because your client may be able to get these drugs from some pharmacy in Taiwan or something doesn't mean that you should say, yeah, give it a try. Because we are not physicians. They need to be under a doctor's supervision. Absolutely.
Yeah, I want to be clear on that.
The only other drug that's, I don't know of anybody who is still put on this and haven't really seen a whole lot, but it's Orlistat. I don't know if you remember this. 90s, Orlistat was a big one. It's a fat inhibitor. So your body basically would not hold on to the fat that you would eat with a meal, and it would go right through you. Well, the problem is when fat goes through you,
it goes right through you.
It goes right through you.
We'll leave it there.
Yeah. So this was one of those that comedians poked fun at for years. What was it called? Potato chips were starting to be made with it. Was it?
Yes.
Orlean? I forget what it was called, but it was Orlistat. It was, or something that helped you not hold on to it. The fat content. And oh my gosh, I had clients who wanted to eat nothing but potato chips, but then they realized, oh, okay, there's a side effect to this.
Not a good one.
And not a good one whatsoever. So yeah, I haven't seen that in, it's got to be 20 years. So I don't think that that's even being suggested anymore, but just be aware someone may ask you about it, and it's not something that, again, I would ever suggest just because the side effects were so horrific. But again, ask your physician. Definitely ask your physician, especially about these new drugs. And keep in mind, unlike phetamine, which has been around, dawn of time. I mean, it's been around
30,
forever.
40 years, I think, at this point.
Yeah, I want to say like the 50s or something, maybe even before that. It's been around a long, long time. And there's been a ton of studies on it. There have not been a lot of studies yet on these drugs. Now, the potential is enormous that it could be a game changer, 100%. But again, like fen-phen, when that first came out, I had a number of clients go on it. And I got to tell you, when they found out that it was being pulled, they were horrified that it was being pulled, and they were willing to risk. And I said, but this is your heart. Understand that this can cause serious heart condition. So we don't know. And it was around for a while before they discovered that. Belviq is another drug that you may have heard a client mention in the past, and it was like Contrave. It helped with feeling full. And that was actually pulled because they showed it had a high correlation with cancer, certain types of cancer. So they pulled that back, and I think it was '05. So that you don't hear about anymore, but it's something that you may have in the past, or you may have been put on it and didn't even realize it if you stopped taking it. So just a couple of different things. So when clients ask you about these drugs, again, make sure you talk to your doctor. Just because you have, like you said it, because you have a wedding coming up, or you got 5 pounds to lose, or the Kardashians are taking it, or I saw this actress, she looked amazing for the red carpet. Well, you know what? It may not have been the right decision. These are also actors who may have been taking, we talk about this with superhero movies, these actors who, take probably a lot of steroids, growth hormone, and all of these type of drugs to get the body that they need for that one moment where they're, without their shirt on or something. I remember hearing Hugh Jackman talk about one of the movies, and he said, "Oh, I have this picture of me. I love it. It's the one that always gets him geared up when he's about to do a workout," and he was ripped to shreds. It was in the Wolverine. He looked amazing. But not only did he have to, basically starve himself and eat hardly anything, but also not drink for 3 days. There was a lot of things dangers. And none of these guys, I've talked to people who interview these people for a living. And one of the writers is, you cannot ask about steroids. You cannot ask about drugs. You cannot, if you are not allowed to ask about that, you can ask about what their workout is, but you cannot ask about these things. Mm-hmm. So that should tell you already that they're probably doing
something else is happening.
And again, much like an athlete, some people are willing to take that risk. And for these people, their bodies are their livelihood. So when they're on the red carpet, they need to look a certain way. I get that. For our clients, it's probably not life and death, or it's not going to help them get another role, and it's not going to affect them financially the same way as a Hollywood actor might, or a singer, or someone who's out in the limelight. So if you have just a few pounds to lose, this probably isn't your best bet. These are serious, pharmaceuticals, and we don't know the long-term side effects. And if they're not willing to see a doctor and be under a doctor's care, then they probably should not be taking this.
Exactly.
Yeah, so just a couple of things to think about. And again, just because people can't afford to take it doesn't mean they should. for some of our wealthier clients.
Right. So as a wrap up, again, we just wanted to bring this to your attention because we know people are going to be talking to you. They're going to be asking you questions. They're going to be wondering like, oh, should I take that? And so one of those things I really want to point out is if you've got a client, again, just trying to lose 4 pounds here, 3 pounds there, not really, I personally would not recommend it to them. That's just my take on it.
Definitely.
If you've got somebody who has been working with their weight, you've been working with them forever, their weight really is not very controllable by all the things that they've done and you've done with them, that's somebody where you might want to say, hey, you might want to think about this. And refer them to a doctor and appropriate medical professional for their assessment.
Yep.
But the other thing, too, is being aware of the blood sugar issues. I think Brian was really clear on that. And that's just a great thing for you to know if your client is going through this, especially I think in the initial stages.
Yes.
They're getting their dosage, ramped up. I think that's going to be more likely.
Yep.
Yeah, trying to figure it out. And then, also be aware that just like try to discourage them if I had my way from buying drugs off the internet because God knows what you're getting. So there's just some little things to think about when you're trying to give your clients good advice on this one. And hopefully this has been helpful. Brian, any final words of wisdom?
The thing I want to say is you'll know the client that this might be appropriate for. Okay? Yeah. Almost every single one of us has worked with a client that's like, look, I've tried it all. They're the person who is eating right, who is exercising regularly, who is doing all the right things, but because of menopause, because of hormone issues, because of a medical issue, or because they're on some other drug. I've got another client of mine who said, I've never had a weight issue hardly in my life. I've never been small, but I've never had a weight issue. She's on some drugs because of cancer issues. Mm-hmm. And she is disgusted by it. But look, she has to be on it for a certain period of time. So these are the people that are going to come to you and ask you, and you're going to know right away. They're the people who are already doing it all. They're trying their best. And you know what? Maybe they need help I'll give a football analogy, to get over that final 10-yard line. You know, they've come as far as they're going to with just diet and exercise, and maybe they need more because there's something more going on that we can't figure out. This isn't the person who it's the beginning of the year and I need to lose 10 pounds. So if you have any question, there is no question. You know, this is going to be the
Right.
this is going to be the person that you know. You're just like, oh yeah, it's her. Mrs. Jones, definitely. You know, Mr. Smith, definitely. Yeah, they've tried everything else. So, you know, that would be my advice, is that's the person that, you know. And my advice to the trainers out there who want to get shredded and want to have, you know, the perfect bodies and things, this is probably not for you. Okay. And again, just because you can get a hold of something, and we all know in a gym environment, things are being sold under, you know, the table. Things are being sold all the time. They actually showed that at one point, you know, 60% of high school athletes had done steroids, you know, 60 to 70%. So drugs can be obtained. Be careful with these. They can have some serious side effects. If you're not careful, always be under a doctor's supervision.
One other thing, too, just a last little thing is most of these are not approved for kids under 12.
Yeah.
So just something else to think about. You know, childhood obesity is an issue, but it's also something that you just want to make sure that, you know, not for children, you know, less than 12 is another thing.
Yeah. Yeah, definitely. I mean, our bodies are changing. Our bodies are changing. And much like you don't necessarily want to do bariatric surgery on a 10-year-old, it's the same thing with this. You know?
Yeah, you don't know where they're going to end up.
Right. And that's
metabolism changes through lifespan.
And that's when you really want to talk to your doctor, especially. I know that there are some people who are like, no, I want to get my kid on it because, you know, I don't want them to go through this as a high schooler. And I get it. I was that kid, and I would have loved to have something like this back then, and I would have qualified, you know, but make sure your doctor's involved. So, yeah.
One other thing is you're not supposed to use any of these while you are pregnant or planning to get pregnant.
Yes.
These are not really approved for that. So just to throw that out there, because both for men and women, which was interesting.
Oh, I didn't know for men.
Yeah, I saw that. I was like, I'd never seen that before.
Interesting.
So,
oh,
yeah.
Good to know.
So I'm not sure if it affects sperm or what, but anyway, just something to be aware of.
All right. Well, I think we've covered a whole lot here. So hopefully you have more information and you can make better decisions for yourself. You can give some advice for when the client says, you know, I'm thinking about, you know, what do you think about this? Or I've heard a lot about it in the news, or I saw this TikTok or whatever about it. You have more information. You can come armed to point them in the right direction. You know, I highly recommend, if you can find a doctor who specializes in obesity, usually they're an endocrinologist. I tell everybody, every trainer, every Pilates instructor that I work with, have your list of referrals. I've got a number of endocrinologists that I work with, and because I worked with them personally, I know that they're good and that they listen. In endocrinology, it's huge, because if they're not listening, they may not be able to figure out what's wrong. So you need someone who can be a little bit more of a detective rather than just, you know, write a prescription immediately. You want someone who's going to dig a little deeper. So find a good endocrinologist in your area, and that way you can refer your clients to them. So
Excellent.
All right.
Thank you, Brian, for sharing your expertise today.
Oh,
that was really helpful.
Of course.
Yeah, this was a topic I don't know much about, and I've learned a lot now from you. So thanks.
My pleasure. My pleasure. And next week, we're going to be covering a little bit more about working with an overweight or obese client, as well as if you are in that category, you know, things that might help you as well. So thanks for joining us on Moving Conversations. Like I say, hopefully this will help with some of your questions that you had on the topic. If you have a topic you want us to discuss, please reach out to us, movingconvos@gmail.com. And until next time, keep it moving, guys.
Thanks.